The reason that we invest our time and energy in Limpopo province in training our staff, our healthcare professionals in neonatal resuscitation is because we want to help all the babies that are born in the province to have a good golden minute. So we're helping all the healthcare professionals in terms of neonatal resuscitation to prevent the perinatal birth asphyxia, because it has been documented that prenatal birth asphyxia is the one thing that will increase the morbidity and mortality of our newborn kids and of our newborn children.
Today I'll be taking you through our practical Helping Babies Breathe guide. Okay, so these are the equipments that we use when we prepare our junior doctors for the training. We have a station for the mannequin where we practice the neonatal resuscitation on. We have another mannequin on my right hand side where we practice the intubation. Before me is a station that is assembled. This is what we call the preparation for the resuscitation. So the station is divided into sections. We've got the airway and the breathing station. This is the station where you find the ambu bag. This is the station where you find the mask according to whether it's a premature. So prematures we use the mask size 0, and for the term ones we use a mask size 1. Then we also have a laryngoscope and a blade. The blade you should have a size 0 for the term ones and a 00 for the preterm. Make sure you have a working light source with spare batteries if you can. You also need to have a lubricant which you would use when you introduce the ET tube through the nostril. Then lastly we have our McGill's forceps which you will use to advance the ET tube, and then we have different sizes of the ET tube depending on the weight. So for all those that are less than 1 kg we would use a 2.5 ET tube. For those who are 1 kg to 2 kg we would use size 3. And lastly, for those above 3 kg, we would use a 3.5. So make sure that when you prepare, you have an oxygen source where you get your oxygen and an oxygen tube where you will connect. Moving on now to the next station, which is the circulation part of the preparation. In the circulation part of the preparation, you need to have your neolite, which is a 10% neonatal light which you use for resuscitation. You must also have a normal saline bag of fluid, 50 ml or 100 ml, and then have a syringe, a 10 ml or 5 ml syringe with some needles. Make sure you have also a gel core or IV cannula for a peripheral line. And make sure you have a drip attachment to your vacuometers. Then lastly also have a securing tape where you're going to use to secure your peripheral line. Have a pair of gloves, a web coil to clean around the area before you insert the line. Should you not be able to put up a peripheral line, you just make sure that you have an NG tube or a UV cannula. And then also within the preparation for the circulation, always make sure you have your glucometer to check the glucose for the baby. In the next station or next compartment, we have our drugs. In our drugs, the emergency trolley, you always have to have adrenaline, undiluted one, and also have something to dilute, meaning that sterile water to dilute your neolite, and also naloxone. We also have, of course, the vitamin K, which you use to administer, and also the Chloromax iron ointment that you apply for all your babies. Okay, so this is our mannequin. Now you are all ready for the delivery of the baby. So you make sure that you have prepared your resuscitation in a flat lying surface. Make sure that the temperature in the room is warm, between 23 to 25 degrees Celsius. Make sure you also have good light source and have your stethoscope as well. So this mannequin is just a demonstration of what you would have a normal baby in a resuscitation or a theater setting. So make sure that the baby has a cap that will cover as well, just to keep them warm and avoid what we call hypothermia. Also, you need to have at least 2 dry towels for you to receive the baby and one that you will dry the baby with. Okay. Lastly, we have our mannequin here, which we use to demonstrate the neonatal intubation. So it should be in a lying flat surface as well, away from drought, in a room temperature of 23 to 25 degrees Celsius. Therefore, now you will pick the ET tube that is suitable for the weight of the patient, as I have outlined before. Make sure that you have a working blade and a laryngoscope that you will use as you intubate. Make sure you have a McGill's forceps that you will use to advance the ET tube. So I will just quickly demonstrate how we intubate our preterms. So you apply a little bit of lubricant, insert it through the nostril, take your working blade and a laryngoscope and slide it through the mouth of the neonate. And as you slide it through, gently pull it up and you can see the cord. As soon as you see the cord, grab your McGill's forceps, hold the tube down and advance it slowly. Okay. And then once it's in, you remove your blade and just make sure you look at the landmarks on your tube. So if you're intubating through the nostril, and this patient is a 1 kg baby, you make sure that you add 7 centimeters to the weight. So for example, a 1 kg baby plus 7 centimeters, you will secure the tube at 8 centimeters. After you are done with that, you can ask for your assistant who will assist you with securing the tube, and then just listen for air entry to confirm if the tube is in. As I back, one of my assistants will be listening for equal air entry. And once you are done, then you can complete the securing of the tube and put your child in a ventilator.